However, some of the 1-year-olds nowadays, they're monsters. I just left the operating room. There's a 4-month-old that's 30 pounds. I don't know how the hell that happened. Yeah. So. And I can stop this anywhere I want. And you can see it's quiet. I don't hear the motor or anything running. Yeah. That's one of the things we needed to do, is make sure this was quiet.
So does the baby fit in that bag?
Yeah. Yeah. So the baby goes inside the Bjorn. So yesterday I put 40 pounds inside the Bjorn.
Wow. So what are you going to do with this at?
Fetal. Yeah, you know the charger.
Take it all the way down to the limit switch, Ozzie. I want to see it show it make contact with it there. Okay, perfect. And what's the purpose of this device as far as the investigation, Ozzie?
It's check autonomic response on newborns. Same thing that we do with an adult for syncope, to see what happens when we stand them up. If they respond normally with changes in heart rate and blood pressure. So we're going to be looking at EEG, heart rate, and blood pressure, and see what changes when we bring them up into a vertical position, 30 degrees.
Because syncope meaning fainting, so that when people stand up, they faint and sometimes.
Basically, what's happening is not like this has been done with newborns, to try to get a handle on which kids are abnormal and try to find out what makes them abnormal, and see if there's anything identified while the baby's in utero. Okay.
And the non-infant type unit that's used for this, and that's what's that called? A
tilt bed, same as this, except there's an infant tilt bed, because this product doesn't exist. So there's tilt tables for big kids and adults, but not for babies.
So this is a one of its kind?
One of its kind, and the tilting has to be done within so many seconds. You can't do this too slowly if you're looking for the autonomic response to kick in. And right now this thing is moving at 10 degrees a second. So to go from 0 to 30 is 3 seconds. I slowed it down because this thing actually can do all 30 degrees in about a second and a quarter. But it stops very abruptly.
So more than likely this would be used within the fetology clinic where they would bring the babies in for an exam?
Absolutely. So right now there's been a change in plan. They're going to put this in that new phytology clinic and try to get as many outpatients that are coming back for follow-up and developmental. And those babies are usually the normal. They're at home. They're coming back. Well, normal from the standpoint they're not hospitalized, and then test those kids.
All right. Thanks, Ozzie.